My name's John. I actually started using a different brand of scleral lenses about 2 years ago, and they didn't work quite as well. So Dr. Bershing had me try, for him also was the new Ovitz brand. And so it's been not quite a year, almost, but it's been quite an experience.
My name is Sandy, and I have been using the Ovitz lenses for about 6 months, and it's been phenomenal.
For me, I've always had poor eyesight, wearing glasses since I was a kid, and then contacts from 18. But about 25, 30 years ago, I started developing keratoconus, misshapen cornea, and continued with just a hard contact lens, trying different fittings and all that. And again, it was always a compromise. My eyesight was never better than 20/40, 20/50. So as part of my complaint when I came from an annual to say, is there still a way to get better vision? And of course, that's where the Ovitz lens came in a much more precise measurement of the aberrations of my eye and there's difficulty seeing in that. And they were able to just tweak it with like two modifications to get rid of pretty much all of the aberrations I was having. I gained at least 1 to 1.5 lines of vision, and it's just been wonderful. One of the things I had problems with was at night, especially driving, with halos burst and that, and those are pretty much gone, and so I can finally drive at night much more comfortably than I had. So vision is better, comfort is wonderful, and again, the lack of any of the aberrations and that has just been great. So
I had a little different situation when I was in my mid-30s. I had a procedure called a radiokeratotomy. It's where they slit your eye cornea so that it flattens it and improves your eyesight. Supposedly to be worn without glasses for the rest of your life. And unfortunately, that didn't happen. I aged. And, as I aged, I developed astigmatism, and that was really difficult to deal with. It's like someone colored outside the lines, and everything is just a little bit fuzzy. The other thing that happened was that I was told that I would not be able to wear contacts again as I had that procedure. And so when I was in getting my eye exam, it was suggested I try contacts. And of course I went, well, I can't do that. And I was told, don't you think technology's changed just a little bit? So here I am. I started out with a soft lens, which did not even remotely try and correct that astigmatism. Everything was still fuzzy. It was not an improvement at all. So this year, Dr. Bershing suggested that I try the Ovitz lenses. And having known that John wore them, I was really excited to try that. The minute that he put those lenses in was amazing. There was the other thing that they did that was amazing is I have a bifocal contact lens, which I believe is one of the first bifocals that they've done out of this office. So it's just been an experience that's I couldn't even ask for.
Yeah.
Two of my very favorite things in life are, and I'm passionate about, is scuba diving, in which I also do underwater photography. And I narrow that down to macro photography, which is the little tiny things, 1/4 inch, 1/8 inch, very small, minuscule things. Without these lenses, I could not see those little things. I had to wait till somebody pointed them out to me.
And that was even with a prescription
mask. Yeah, that was with a prescription mask. But it just, with these lenses, I put on my scuba mask, I hop in the water, and I can go find all of my own little subjects. I take my own pictures, blow them up. It's just been amazing to actually be able to see those things underwater again. It was a phenomenal experience from the staff, the doctors, trying to get exactly what I was hoping I would get. He worked very well. it